Good morning and a warm welcome from Docplexus. We're here today shadowing the life of esteemed Dr. Parag Sancheti. He's a chairman and managing director at Sancheti Hospital, carrying forward his father's legacy, Honorable Dr. K.H. Sancheti. Dr. Parag specializes in sports medicine and arthroscopy. Under the leadership of Dr. Parag, Sancheti Hospital enjoys tremendous trust amongst its patients, not just from India but from overseas as well. He is also credited for initiating and creating awareness about the concept of medical tourism in India.
Good morning, Dr.
Hello,
Sancheti.
good morning.
How are you today?
Fine, how are you?
So, how do you like to begin your day when you reach the hospital?
I come, I pray to Lord Ganpati, and then the day just flows.
Okay. An important part of Dr. Parag's day is his morning ritual of offering prayers to Lord Ganesha. He believes it sets a positive tone for the rest of his day. This morning, his day started off with clinical meetings, particularly the CROP meeting, which stands for Clinical, Radiological, Orthopaedic and Pathological Meeting that occur monthly in the hospital auditorium. This meeting includes hospital surgeons, residents, as well as specialists from other institutes. So how was your discussion?
So this was nice. So this is, we do, I told you, once in a month. Every Thursday we have an agenda. We'll either do a morbidity mortality meeting, we will do a crop meeting, what you saw today, or we'll do a journal club. And one Thursday we do a infection control meeting. So this is the agenda every Thursday, and this is done in the auditorium because you see the crowd is large and we get radiologists, pathologists from other institutes also attending this meeting. After this I make rounds and then I go to the OT. We have one ACL reconstruction, we have one ACL avulsion fixation, one total knee replacement, and one medial meniscus repair. This is my list for today.
Yeah, so you also get to know what surgeries are lined up for you in the entire
so
day.
we plan that the previous evening, the order is decided. So the anesthetists are already now inducing the case.
Yeah.
So I finish my round and then we will go to the OR.
Daily rounds are a part of every doctor's day. Dr. Parag, with his team of ortho residents and physiotherapists, followed up with his pre-operative as well as his patients in recovery.
नाही आज काही छोटं चांगली झाली आज मीटिंग गुड केसेस यू हॅड So line of treatment is to do the biopsy. Dr. Yogesh is our orthopedic oncologist, so he will be doing the biopsy, and once the biopsy report comes, it will prove the diagnosis whether it's a fungal infection or something else. मोठा हलवा असं वर करा दुखतं का
नाही
आज तुकडा काढून घेऊ इथून तपासणीला आणि मग तो रिपोर्ट आला की ठरवू काय. Hello. Shake hand. So, she had a bilateral congenital talipoequinosis. There was manipulation done, and now it has been. She also has dysplasia of the hips. So surgery has been done, and now she is rehabilitating. They are mainly admitted for rehabilitation. So this was the hip surgery. Now recovery is fine already. She's walking. She's doing rehab. They are very happy. How do you feel? How is she doing now? How is the recovery?
Thanks God.
Okay. Good. Okay. Bye bye. Bye bye. अरे बघू त्याला आता ओटीत घ्यायला सांगितलं त्याला आता फिजिओथेरपी जास्त द्यायला लागेल इंजेक्शन द्यायला लागतील त्यांना इंजेक्शन डेपोमेट्रॉल द्यायला लागेल.
Good part of his day is spent performing surgeries. Let's check in with him to see which surgery he's performing first.
So we have to fix it with a screw.
Okay.
So this is the MRI. You can see the ACL avulsion is here. So we will now take inside. The patient is getting ready for anesthesia.
So the patient right now, he was
is
admitted due to trauma?
Yeah, yesterday he had a fall.
Okay.
And therefore this bone has come off. So we will do it arthroscopically. We have to fix it.
As we all know that OT procedures are really strict. So you can see even I am getting prepped for the OT. Let's go.
Sir, as you know, scrubbing is so important.
Yes.
So which is, I think, approximately for 3 minutes.
Yes.
So what are your thoughts during these 3 minutes?
So the thoughts are as follows. First of all, you have to scrub well. You have to clean all the parts, the nails in between the fingers.
Okay.
First 2 scrubs you go till the elbow.
Alright.
And then you go below. So this is a routine. So we really don't think much about it, but sometimes you forget to do it. So Actually, this is very critical for prevention of any infection.
What inspired you to become a doctor and then take orthopedics as specialty?
Yeah, so as you know, my father is also an orthopedic surgeon, and I've always been seeing him since I was a kid. And he never forced me to be a doctor. But since that seeing operations from the age of 10 years, seeing him operate, seeing him work, that was kind of there behind my mind. And after 12th standard, fortunately I got good marks and I got admission to the government medical college in BJ Medical. So then that was even one more reason why I took up medicine. And then I had an inclination to become one doctor.
His surgeries involve the use of minimally invasive laparoscopic technique, which require a shorter incision to expose the joint, leading to reduced post-operative pain and a faster recovery. Despite his busy schedule, Dr. Parag makes some time every day to meet his father, respected Dr. K.H. Sancheti, for a daily discussion.
As doctor said that you've been practicing for like 52 years now.
Yes.
So what difference do you see in the practice that you did and what Dr. Parag is doing now?
Right. When I started my practice, that time the number of surgeries were not as much as they are seen today. So right from children surgery to old man surgery, all were done by me. But now, in the recent days, as Parag has studied the knee problems in detail, he knows very many other operations which were not that time. He also studied the arthroscopic evaluation and treatment of the injuries inside the knee which were not there that time. And with the modern treatment which is following, the patients are much more benefited. There is a precise diagnosis, there is a precise treatment, and patients are getting cured in their problem, which I have seen with my own eyes, and that's how he has become successful in his practice.
As the chairman of Sancheti Hospital, he is also involved with various management activities.
Hi.
One of which is a weekly board meeting.
So now we are having our top management meeting. I try and meet them once a week, so that get an appraisal of the whole thing.
But that how do you manage your time with you have so many surgeries? Plus, I also know that you are president and board member of other associations here. So how do you manage that?
No, it's ultimately a good team. So for my political responsibilities, I'm the president of Indian Association of Sports Medicine, president of Maharashtra Orthopaedics Association, also president of Asia Pacific Arthroplasty Society. So that does take a bit of my time, but I have a separate team who manages that and takes care of that. So things fall in place. So it's ultimately a day has 24 hours, so you just have to plan, and the same is for any people.
Hours do you work in a day?
Yeah, I come at about 7:30 in the morning and I leave by about 9:30, 10 in the evening. So that's a typical day for me, but it's hard. Sometimes it's hard on the family.
Yeah, right.
Okay, so we'll start the meeting.
Following his board meeting, Dr. Parag conducts resident training sessions discussing important aspects of patient care. Given his skill and expertise in the field of orthopedic surgery, Dr. Parag's OPD generally includes patients from all parts of the country who are seeking treatment for their illness.
So Dr. Parag, recent advances in robotic surgery seem favorable. So what are your thoughts on that?
Yes, so robotic surgery has come a long way, and it has been recently introduced in orthopedics too. It is being used in knee replacement, also in certain trauma surgeries. So I think in orthopedics it is still being proven. My principle always has been that whatever is the new technology, don't be the first one to embrace it. Let it be proven, don't be also the last one. But something, once it's proven, you can use it.
Okay. So you also have a lot of publications and you are doing a lot of research.
Yes.
So you would like to know something about.
So research is one of our fortes, and since more so last 7 or 8 years we've done a lot of work in research. We have about 13 to 14 publications every year getting into peer-reviewed journals. Till now, in the last 7 years, we have more than 250 publications, and I think that is very important, because if you don't publish, you perish. That's my principle. So it's important to publish. There are two advantages of this. One, somebody else is recognizing your work. You have to submit it to a journal. The editorial board will recognize. And second, you yourself stay abreast.
So lastly, I would want to ask you, how do you stay so motivated and disciplined? Because I went through your day and it is actually a difficult job. So how do you manage that?
Well, end of the day, what I feel is that if you can make a patient happy, and if he is going to be happy with your work, then that is what gives me a lot of satisfaction. So whenever I see a smile on my patient's face, I feel very inspired, I feel very motivated to do more work. And many people ask me, what would you like to be in your next life? So I always say, even if God gave me an next life, if at all it exists, I would still like to be a doctor and an orthopedic surgeon, because a smile on a patient's face motivates me, drives me and inspires me.
So we would like to thank you, even from Docplexus. Thank you for giving us a chance. We could see your day, we could see all the functioning of the hospital. It was really pleasure, and thank you so much.
Thanks to you for inviting me, and thanks to following me and seeing me through my day.
Thank you so much.
Wish all the best to Docplexus too.
Thank you so much.
Thank you. Bye-bye.